All right, that looks like we've stabilized a little bit. All right, well, thank you again, everyone, for joining us on our latest media briefing on important healthcare issues. As we well know, I'm Dr. Samantha Hill. I'm president of the Ontario Medical Association and a cardiac surgeon. We at the OMA represent more than 43,000 doctors and medical students across this province. I'm also the mother of two fabulous young boys, one of whom has spent a third of his life in pandemic restrictions and resultingly has had a very different childhood than his brother. That social restriction, the diminished opportunities, it's had a lot of parents and experts concerned, and obviously I get it. But other concerns related to our children and their well-being haven't been as easy to acknowledge. As Ontario fights through a third wave lockdown, as doctors are treating a record number of infections, today, we're here to talk about the potential long-term effects of COVID-19 pandemic on children's health and what we as parents and society can do to mitigate those. We'll be talking about new data indicating that fewer Ontarians are seeing doctors during the pandemic. In particular, there's a large drop in the percentage of children who've been seen by a doctor in the pandemic's first year. We'll also be looking at the changes the pandemic has brought to children's routines, the impact of these changes, and how we can continue to support our children. We'll discuss the newest information on COVID vaccine trials for children and the pandemic's effect on childhood injuries. So a lot of information to cover. We'll start with a discussion of an analysis of OHIP billings that found that the number of children being seen by a doctor during the pandemic has dropped by more than 30% compared to 2019. Adults saw their doctors 14% less on average over the pandemic year. The age group that was most affected is children between the ages of 4 and 8, and their interactions with doctors was down 39% in 2020 compared to 2019. The age group least affected is newborns and infants 3 and under, and their average drop was still 24%. We don't have all the answers as to why there has been this drop off. It's possible children had fewer illnesses because they've been at home and following health protocols. This, we know, has resulted in fewer cases of the flu, and that may follow through to children as well. Fewer colds, fewer flus. It's possible that this is a sign of careful hygiene paying off. But it's also possible that people are choosing to stay away from their doctor rather than go out, that people are fearful of the pandemic, justifiably, and are being limited in their access to physicians based on that fear. And the concern is that this will contribute to an already considerable backlog that the health system will have to clear. More importantly, potentially, this could also contribute to worse outcomes and far more challenging care situations for everyone involved. If children have not kept up with their immunizations, that's also immensely troubling and will result in future health issues that need to be managed. Willingness to see doctors has seemed to ebb and flow with the waves of the pandemic, the severity of infection rates throughout this time period. We understand that Ontario residents and Canadians across the board are trying to avoid public gatherings, and we thank them for that. We understand that perhaps they've been putting off seeking care for themselves or their children in the initial months of the pandemic. But now we are into the pandemic's second year. And as physicians, we are troubled by these findings. I want Ontarians to know that their doctor's offices are open and physicians are available to you in a variety of ways. We encourage all Ontarians to get the right care for themselves and their children. Keep up with your child's immunizations. Make sure any health issues are addressed and addressed early. Raise your concerns with your physician. Now, I'd like to turn to the three guests who are joining us today to discuss the pandemic's long-term effect on children's health. Dr. Saba Merchant, the owner and director of Maple Kids Clinic in Vaughan, where she has been a pediatrician since 2004. She's a member of the Ontario Community Clinic Working Group set up by the OMA's pediatric section. And this was set up during the pandemic to write guidelines for reopening medical clinics and to provide support for pediatricians around the province. Dr. Vicky Farah is an infectious disease specialist at Markham Stouffville Hospital, where she is also the primary investigator for this CATCO and WHO Solidarity clinical trial. Solidarity is one of the largest international trials for COVID-19 and their treatments. Dr. Daniel Rosenfield is a pediatric emergency medicine specialist at the Hospital for Sick Children, an assistant professor of pediatrics at the University of Toronto. He's the site director for the Canadian Hospitals Injury Reporting and Prevention Program and maintains active research into pediatric trauma and injuries. So let's start with Dr. Merchant. Dr. Merchant, would you please begin by talking about the changes that the pandemic has brought for children, lacks of routine, social isolation, those kinds of things, and then maybe give us some ideas about how we can all support children through the pandemic.
Thank you, Dr. Hill. While COVID-19 is pretty benign in children, typically not causing many issues, the pandemic can have very long-lasting effects on children and youth. Over the past year, I have seen significant changes in the lives of children. The inability of the children to attend daycare, school, and extracurricular activities has taken away routine and structure from their day and led to social isolation. During the pandemic, we have coined the term social malnutrition. We know that the peer interactions that are occurring with peers, the sharing that occurs between children forms the building blocks for emotional and social development. Unfortunately, with the economy weakening, there has been financial stress in families and has led to housing and food insecurity in some children. And in some more unfortunate children, there has been neglect and abuse, specifically in dysfunctional families. All these adverse childhood experiences have led to a decline in mental health, decline in social and emotional development, a decline in cognitive development, and to a certain extent, a decline in language development. I must say that what we are seeing is just the tip of the iceberg. In the past year, I've seen a skyrocketing of cases of anxiety, depression, suicidal thoughts, inattention, obesity, eating disorders, obsessions, compulsions, and the list just goes on. How can we support these children is what I'm often asked by parents. And intuitively we think, maintaining social exposure, which is hard given our current circumstances. I recommend forming small bubbles with family and friends as long as that's safe and as per public health guidelines. If your teenager is asking for a little extra time on the screen so that they can socialize virtually with their friends, please reconsider that request. I would like to encourage group activities in school, whether that's online or in person. Of course, we want to keep schools open as far as possible, as far as it's safe and as per public health guidelines. I want to reiterate what Dr. Hill has already said, that when we see early signs of mental health decline, developmental delay in our children, please contact your family doctor or pediatrician's office. We want to intervene early. We know that in children, intervening early leads to better outcomes. We want everybody to be vaccinated. The children don't have their vaccine yet, and we're going to hear as to how long it will be before we can get them. But our best chance at normalcy in our lives is at getting everybody vaccinated. If you are someone who's on the fence and has not made up that decision, do reconsider, if not for yourself, for the sake of these children. I call them the silent sufferers. We don't have a COVID-19 tracker on what's happening with the children. We see the cases of the case numbers, the hospitalization numbers, the ICU admission numbers, and mortality, but we don't have that COVID tracker for children. And it's about time that we all know about that. I'm also hoping that going forward, we have more publicly funded mental health resources to help us deal with everything that we're seeing with children at this point in time. Thank you.
Thank you, Dr. Merchant. And I'm laughing because we were just talking about the troubles finding that mute button. It's an exceptionally important topic that you've raised, and you've certainly done it a great deal of justice, although I suspect if we were able to give you 2 to 3 hours, you could fill that time as well with very insightful comments. I'll flag that the mental health challenges that you're seeing, we're seeing them across the board. COVID's been really hard on everyone. The idea, though, is that children may be less able to ask for help on their own. And so it's really important as parents and as society that we keep an eye on our children and that we keep an eye on early signs that they might need a little bit more help than we can offer individually. Dr. Farah, I'm going to call on you next. Can you tell us where we are in terms of pediatric COVID vaccine trials?
Hi, can you see me? Can you hear me? Great. Okay, so actually we're doing quite well with the pediatric vaccine trials. As you know, there's 4 vaccines that have been approved in Canada, the Pfizer and the Moderna, which are mRNA vaccines, as well as the AstraZeneca and the Johnson & Johnson vaccines, which are adenovirus viral vector vaccines. So the Pfizer and the Moderna vaccines are actually doing quite well. So I'll get back to these. Unfortunately, the AstraZeneca vaccine has actually been put on hold in terms of the pediatric trial as of last week. This is due to some issues relating the clotting findings with the AstraZeneca vaccine. This is a trial that was looking at 6 to 17-year-olds, and it'll be interesting to see how that moves forward. The Johnson & Johnson vaccine recently announced that they were going to expand their phase 2b trial to include 12 to 18-year-olds, and they were going to start with 6 to 17-year-olds as of this month. However, because the Johnson & Johnson vaccine has been put on hold, at least in the States, it'll be interesting to see how that pediatric trial moves forward. Getting back to the Pfizer and the Moderna pediatric trials, Pfizer is slightly ahead of the Moderna vaccine. They're actually doing quite well. They have 2 studies. The first study was looking at 12 to 15-year-olds. Remember, Pfizer is actually approved up to 16 years of age. So they actually concluded that trial early in the winter, have analyzed the data. And as of last week, there was a press release saying that this is a very efficacious vaccine for the 12 to 15-year-old age group. And we're hoping to see data, raw data for that in the upcoming weeks. This is very encouraging. The goal here is to actually start vaccinating soon. The company has asked for emergency approval both in the US and the UK, likely also in Canada shortly. And the goal, as I said, is to actually start vaccinating so that this age group is vaccinated prior to going back to school in the fall. Very encouraging. The second age group is the 6-month to 12-year-old children. This is a dose escalation trial followed by a randomized trial. They have started enrolling for this trial as of February of this year. And the goal is to actually get some data by the end of 2021 and start vaccinating by early 2022. The Moderna trial, pediatric trials, that vaccine also has 2 pediatric trials, the Teen Cove and the Kid Cove. So Teen Cove has actually completed their enrollment as of December of last year, and I think any day now we should be looking for results from that study. This Teen Cove study looked at 12 to 18-year-olds. And the goal here, if the data looks promising, is to get emergency approval quickly and move forward with vaccination heading into the fall. The second trial for Moderna is very similar to the Pfizer trial. The Kid Cove trial looks at 6 months to 12-year-olds. They actually divide it in this age category into 3 groups, the 5 to 12s, 2 to 5-year-olds, and the 6-month to 2-year-olds. Again, this is a dose escalation trial followed by a randomized trial, and they've actually just started enrolling in the US and very excitingly will be enrolling sites in Canada moving forward. We don't know where those are yet, but both mRNA vaccines look very promising in the pediatric population.
Thank you so much for that, Dr. Farah. That was a lot of information, and I expect many of our reporters will have questions on that either now or later. So I encourage people with questions to either put them into the chat box or reach out to us to see if we can help facilitate an interview with Dr. Farah. Lots of information. All of our panelists remain ready to help you communicate the information as best possible to the public. Before I move on to Dr. Rosenfield, I will take the opportunity of us having discussed vaccines to remind all of these parents right now that the best things they can do to protect their children today is to continue to abide by all of the public health guidelines. And that includes, of course, masking, washing your hands, staying away from other people, stay-at-home orders where they're in place. But it also includes getting the first vaccine available to you as soon as it is available. And we know that there's been a lot of media controversy over which vaccine is better, but frankly, the risk of waiting for a different vaccine outweighs the risk associated with any of the vaccines. All of the vaccines are proven to have amazing results against death, against hospitalization, against needing an ICU. And that is one of the few things that we can all do right now to help protect our children. With that in mind, I'll turn it to Dr. Rosenfield. Dr. Rosenfield, what can you tell us about the changes you're seeing in childhood injuries in the emergency department during the pandemic?
Perfect. So thanks very much for having me. And I'll just chat a little bit about my personal interest in injury and injury prevention. So as I mentioned, I'm an emergency physician at Sick Kids, and I do kind of a lot of surveillance research with respect to injuries that are seen in our department. So as we've already alluded to, our emergency department volumes in 2020 dropped significantly. What didn't actually drop very much at all is the number of injuries and poisonings or ingestions that we saw during that time. So there was a little bit of interest in it last summer, but we've done a more robust analysis, and the cycling injuries we saw last year compared to 2019 nearly doubled. So we saw about 300 in 2019 and saw just over 700 in 2020. The majority of these injuries were actually minor in nature, so cuts, scrapes, bruises, a couple of broken bones, and of course some severe traumas. But overall, the proportion of changing injury pattern wasn't significant. Fast forward to winter season, and kind of along the same lines, we saw an increase in tobogganing injuries, especially on snow days during the lockdown when kids didn't really have anything else to do, and so they were outside on the toboggans. Again, the majority of them were minor injuries, but we definitely saw some major traumas and some very unwell children following these types of collisions or crashes. The overall other injuries, we actually hadn't seen much of a change. So falls, scrapes, broken bones, that sort of thing hadn't really changed for pre-pandemic or post-pandemic, which was interesting. The main point I try and make here is, when you hear increased injury data, people immediately assume that's sort of a bad thing. Why are kids hurting themselves? And I would actually argue the opposite, that this is actually indicative that kids are actually getting out there and doing something we call risky play, which is actually encouraged for both their gross motor development, often their social development, because they're doing these activities with other children. And just learning kind of the world around them. So the fact that we hadn't seen a significant rise in major trauma is actually very encouraging. And so I would say, going into this summer, we're going to want to continue to encourage children to be active and to get out there in their bicycles if they can find one, and other activities that get them outside. We know the benefits of this far outweigh the risks to them if they get injured. And if they get injured, our emergency department doors are always open and ready to take care of them. The next kind of injuries type of presentations we saw were ingestions, and that's really divided in two groups. So there's the preschool group where they're largely unintentional ingestions, and then there was the adolescents and teens where they're more intentional. So I'll divide those up now. So we did see about 17% more ingestions in the toddler age group in 2020 compared to 2019. The most common ingestions are household products. So those of you with young children, myself included, know they have prying hands, and they're looking when they're bored, which they would be during lockdown, they're looking everywhere for what they can play with and what they can put in their mouths. So the majority we saw were household items like moisturizers and creams and detergents and things of that nature. Most of them are relatively benign, but absolutely, again, to parents' medications, grandparents' medications, who are often informal caregivers when schools were closed. And these can actually be very significant. So we definitely saw some children who were more unwell with significant ingestions. The other thing that's new in the last few years is cannabis edibles ingestions, and we've seen a significant increase in that. And that mimics literature across the globe in any area where cannabis was legalized. Edible ingestion in children just goes up because they're brightly packaged, they look like candy, and children think they're great. So that's what we've seen in the toddler side. On the teen side, we've seen a significant increase in intentional ingestions, often in either suicide attempts or sometimes out of boredom, experimentation with medications, prescription medications, again, sometimes other substances like bleach or lye or things of that nature. And so we know that the last year we've seen approximately 25% more of these kind of suicidal ideation or suicide attempts present to our emergency department. And I know other places across the country have seen the same. And that's sort of the overall picture with respect to injury that we've seen. I would use this opportunity just to remind all parents and families that we don't know why those numbers have, as Dr. Hill mentioned earlier, have decreased in terms of who's coming to our emerge, but we would like to reiterate that our emergency department is safe. We are prepared to deal with your patient and your family, your child in any capacity, be it infectious disease like COVID or injury or trauma in that nature. And we're taking all relevant precautions to make sure that they stay safe. So I'm happy to field questions and answer anything else.
Thanks so much, Dr. Rosenfield. And on behalf of all of Ontario's doctors and probably all of Ontario, I'd like to thank Sick Kids for making space and taking up basically the entire pediatric population, or certainly the great majority of it across Ontario, in order to allow other sites to focus on the overwhelming tsunami of COVID patients coming at them. We are very, very grateful for the collegiality and collaboration of our colleagues, and I know patients are as well. Thank you across the board to Drs. Rosenfield, Dr. Farah, and Dr. Merchant. We are now going to turn the floor over to Ryan Joyce from the OMA, who will open up our question and answer session. Please, as always, put your questions in the Q&A chat. If we don't get to your questions due to time, the media will follow up with you. You can also email us at media@oma.org with additional requests for interviews from any of these fine people. And we will also have a recording of the session available later this afternoon if you need to go back and double check something. Ryan, over to you.
Thank you, Dr. Hill, and to our panelists. The first question is from Kristen Callis at Pickering News. What sort of an impact is the lack of socialization during the pandemic having on young children, toddlers and preschool age children? I'll start with Dr. Merchant with that.
So it's a question that has been asked so many times by parents as well. So we have preschoolers and even younger children in daycare. Attending daycare has many advantages. First of all, it provides a routine. A child's development thrives on consistency, and that kind of structure is important, whether it's preschool or daycare. Socializing, so having peer interactions, sharing is so important to developing both socially and emotionally. And so I would say that because of that, we have seen some mood issues as well as mild delays in language development. It's hard to say because it's been only a year, but those are some of the few things that we are seeing. We might be even beginning to see some difficulties with socialization and the little nuances of socialization that children learn when they are in the company of others. So those would be sort of the main 2 or 3 things that we are seeing in the age group between 2 to 5. When it comes to cognitive development and pre-academic skills, they are not attending school regularly, and some of the things are being done at home. So I don't think I've seen as much of a change in that area.
Great, thank you, Dr. Merchant. The next question is from Alan Britnell at Today's Parent. And this question I'll direct to you as well, Dr. Merchant. Has there been any increase in the number of young children or their caregivers seeking mental health care as a result of COVID-19, lockdowns, remote learning? What about suicide attempts?
So I am a pediatrician. So my contact is mainly with parents, and they come to me because of their children. So first of all, I guess I'll speak to the children. So when it comes to the children, there is more resilience, I think, in the younger ones than in the little older ones when it comes to mental health. But again, the fact that there is no daycare in school means that the children are at home, and the parents are having their own jobs that they have to attend to, and these jobs could be virtually. So parents are home and they are, at their job virtually, and the child's at home too, and they're not getting the attention they need. But in turn, the parents are being completely overwhelmed by the responsibility of having to attend to their job as well as to attend to their children. So I've heard from a lot of parents that this has caused immense stress for them. So I'm speaking about when I'm having my interviews and my appointments with them, they are expressing this to me. And on many occasions, I found myself telling them to seek help. If the things have not been going well for them, and that this is something would be important for them to do, because if they are not seeking help for themselves, they will not be in a position to take care of their children, and the children are dependent on them.
Thank you, Dr. Merchant. The next question is for Dr. Farah. What's your most optimistic prediction for when kids will be vaccinated, either internationally or here in Canada?
So my hope is that we will actually give emergency approval to the Pfizer and hopefully Moderna if the data looks satisfactory for the 12 to 18 or 12 to 15 age group, and that we will be starting that very shortly so that these kids are vaccinated going into school by September. The rest of the children, I'm hoping will start vaccinating in the winter.
Thank you, Dr. Farah. The next question is for Dr. Rosenfield from Pauline Chan at CTV News. 25% increase in suicidal type ingestion emergencies seems like a dramatically big jump. Can you talk more about how and why this is happening and what parents can do?
So I 100% agree that is a significant increase, which is why we're obviously discussing it today. I would say that, my role as an emergency physician, I can't really speak to the causes are certainly the pandemic, and that's kind of we've alluded to today, but I don't have any further insight. I would actually have to refer that back to our team and their mental health professionals to look into deeper insights into that.
Thank you, Dr. Rosenfield. The next question is a follow-up from Alan Britnell at Today's Parent and for Dr. Merchant. What signs should parents, caregivers watch for that might indicate their child is struggling with mental health issues?
So we've been saying to parents that if they're seeing any shift in the child's routine and in the child's behavior, then that would be a red flag. For example, sleep. So if the child is sleeping more than expected or less than expected, is irritable during the day, is having nightmares around food, if children are eating more than what they normally do or eating less, and hence either gaining too much weight or losing too much weight. If their mood is lower, they seem to be tearing up very quickly. If they're being very irritable and they're losing their temper quickly and getting into fights more than usual. If they are not showing an interest in the hobbies or the recreational activities that they had before, if they're not showing interest in wanting to meet up with their friends or even having a call, a virtual sort of connection with their friend, these all would be considered red flags for something being off, and not for 1 or 2 days. We're looking over a period of time. Even a few weeks would be something that we would consider as a red flag. And specifically so if the child already has a pre-existing neurodevelopmental issue, like autism, ADHD, or a learning disability, or if there is a very strong family history of mental health issues in that particular family, then in that context, this would take even more of a significance. And we are asking, as I said in my initial introduction, that please do contact your health provider, whether it's your family doctor or pediatrician. We have concerns with things getting to the point where children are now having suicidal thoughts and are talking to their friends about it. And then the friends are talking to their parents, and the parents are then coming back to tell this parent that, this is what your child has been saying. So, we want to sort of nip it in the bud and address it much earlier.
Thank you, Dr. Merchant. The next question I'll ask Dr. Hill to answer. It's from Mike Pearson at Hamilton Community News. How would you respond to some of the rhetoric coming from anti-lockdown rallies, arguing that younger people should be set free from some of the gathering restrictions because they are less likely to die or suffer serious health effects from COVID-19?
Thanks so much for that question. And it's an important one because I think it highlights a couple of places where we can communicate very clearly around some misunderstandings. The first is that while children and young adults currently may have a lower death rate associated with the virus, they still have and can have significant disease and significant consequences as a result of having COVID-19. We've seen young athletes have their career ended because of respiratory and lung issues that have prevailed after their infection. And we've seen persistent heart disease and heart issues, vascular issues after COVID-19. So survival isn't the only thing we're concerned about. The other part of this is that despite the fact that they may do better than their parents or their grandparents, they are part of the community. And so when we talk about community spread, they are an important component of that. In fact, about a third of the population, I think, falls into the younger category. And so until we have a vaccine out that can be given to all of these young people, they have to have their restrictions, their socialization and their activities restricted the same way everyone else does in order to curb that community spread that currently is still exponential. And that's why we've had to do things like halt non-emergency and non-urgent surgeries. The last thing is just a look to the future. We've already seen the virus mutate several times, and those have shown us that it can mutate and be more aggressive, more infectious, and more dangerous for younger cohorts. We've gone from being predominantly worried as a society about the elderly to now acknowledging that the 40 to 60-year-old groups are at particular danger with the new variants. And there's nothing to say that the next variant, the next mutation won't be directed more towards children, won't be more dangerous towards children. And so I don't want people to panic. We certainly haven't seen that happen, but it's all part of the reason why everyone has to be in the same restrictions together right now.
Thank you, Dr. Hill. The next question is from Louise Legere. Apologies if I pronounced your last name incorrectly, from the Medical Post. With increases in pediatric anxiety, depression, and other mental health issues that have developed, what is the likely long-term impact? Post-pandemic, are children and teens expected to recover completely, or would you expect a lingering or long-term mental illness? I'll ask Dr. Merchant to answer that question.
So we actually have a study that came out of sick kids at the end of February, which looked at the first lockdown and the prevalence of anxiety and depression in children, and it was at about 40%. And we've certainly seen a significant increase. How long this is going to last is very hard to say. But like I said, I think we are seeing the tip of the iceberg only at this point. So I have a feeling this is going to last much longer. We have some historical data from the Spanish flu. And I was looking this up on the weekend, and this was in 1918 and 1919. So somebody actually did look at the admissions to the asylums. They called them mental health asylums at the time. And there was a 7-time increase up to 6 years after the Spanish flu. And so that study actually only went to 6 years. So it could have been potentially more. So that is certainly an indicator that some of these things can last quite long, because these are young children and the impact can be quite deep on their mind. And this sort of brings me back to what I was saying previously, that it is important that we nip this in the bud. So if you are seeing early signs, you're seeing red flags in your child, please get help so that we can address it earlier, so that we can cut down on sort of the long-term impact. But it will be very hard at this point to say as to how long it's going to last. The cognitive development has been affected by, you know, the attendance of school off and on. And by speaking to some of the teachers, they will say that at where we are currently, the kids are behind by at least a year. And that might be a bit variable in terms of the different students. And I would expect that for the younger kids, language development is definitely affected with lack of exposure to peers as well as other people. So the cognitive and language development, I think, will catch up sooner, but I think the mental health may last beyond those two areas of development.
Thank you, Dr. Merchant. The next question is for Dr. Rosenfield. When parents bring their kids to the D with injuries or poisoning, are they expressing any unusual pandemic concerns or challenges?
I mean, I don't know if there's anything unusual. I think the vast majority of these ingestions and poisonings that we seen have had some relation to the pandemic, because it obviously embodies itself in every interaction we have. So, you know, a very classic story from most families is, you know, I work from home, I had my toddler being watched by the older sibling, and then they got into X, Y, or Z. So the way the pandemic obviously is significant, and these are kids who likely would have been in school, but for the shutdowns. So that's certainly, you know, the pandemic is, you know, responsible for that sort of interaction, and likely responsible for that increase that I alluded to earlier.
Thank you, Dr. Rosenfield. I have two questions now for Dr. Farah. The first one is, what is the spacing between the first and second jab for children? And do they need to keep masking, distancing, and hand washing after the first jab?
Yeah, that's a good question. So right now, what we know is based on what they're doing for the trials. And so for the Pfizer vaccine, it's the 21 days. For the Moderna, it's the 28 days, and so on. There has been no direction in terms of delaying the second vaccine dose for the children moving forward. And we don't really know what that will look like moving forward. The second question is, yes, until we have further guidance from public health, everyone needs to adhere to public health measures, regardless of your vaccination status. And once public health feels comfortable amending their guidance, then we will follow that amended guidance. And the same will go for children once they start being vaccinated.
Thank you, Dr. Farah. The follow-up is, how long is the COVID vaccine effective for children after the second jab?
So I'm sure that'll be part of the vaccine trials for the pediatric trials. Like all the other vaccine trials for COVID, the children will be followed for 2 years. We just don't have that data yet, but I'm sure they'll be looking into that.
Thank you so much, Dr. Farah. Next question for Dr. Merchant. You mentioned dysfunctional families. How do you define that, and how is the pandemic affecting these families, especially kids? Are there signs parents in these circumstances should be looking for?
So, well, dysfunctional families are families where the dynamics are affected in terms of them being caregivers and being able to take care of their children. So we may have families where parents have mental health issues, one or both parents, and we may have families where there is marital discord. We may have families where there is financial stress. And these are all factors, and I want to add substance abuse as well. And these are all factors that affect the ability of the caregiver to take care of their children. So this is how we would broadly classify dysfunctional families. So for a multitude of reasons, they are unable to provide the care that a child needs. Sorry, what was the follow-up question to that?
What can parents do to help if they, sorry, I was reading a different one, my apologies. I think it was what signs can parents be looking for in these particular circumstances?
So I clearly, children who are in dysfunctional families are at very high risk for mental health decline, for developmental delays, for school issues, just because they're dealing with all of this at home that they are unable to develop in a regular manner. So for all of us taking care of children in dysfunctional families, we already have it documented that this child is at high risk. And so we carefully watch these children and make sure that they receive the support that they need. We try to develop very strong connections with their providers so that we can even direct them to get help as required. And of course, in extreme circumstances, then we need to get external help for these families, which we try to avoid as much as possible. But if we find that there is no other option and that the parent needs immediate help and that the child needs immediate help, then we have those options available to us.
Thank you, Dr. Merchant. Next question, I'm going to start with Dr. Hill, but I'd invite other panelists to answer if they would like. Being a single parent is especially challenging during this time. Do we have any advice for single parents?
Oh, that's an excellent question. So as a single parent myself, I feel I understand why you targeted me for that one. It has been exceptionally challenging. It's been a question of lack of resources. For the most part, you simply can't split yourself into two parts to do your job and take care of people. And there's often the idea that if there was another adult around, you could maybe shift work a little bit and you could have a little bit of extra buffer. But honestly, my best advice to all of the single parents out there struggling through this is to realize a few things. One, that you're not alone. We are all struggling in this together, and that will be true across society. Everyone has recovery to do after this. The second part is to be kind to yourself. Dr. Merchant said it earlier, if your kid wants a little bit more time on the screen to socialize or to interact, maybe we ease up a little bit on those no screen guidelines. I know that before the pandemic, I was very strict about how much time my children spent on the screen, and now they know the passwords and how to navigate through the iPad. And then the third thing is to look for resources. Often we're not great at looking for help for ourselves, but find another single parent family, find another family that you can bubble with, find a way to make sure that you too have 10 minutes or 20 minutes a day to yourself, to go for a walk, to breathe, to be able to recenter, because our kids don't do well when we don't do well.
Thank you so much, Dr. Hill. At this point, I'd invite any other panelists if they would like to answer that question, or I'll move on to the next. It's almost a follow-up to the last question. How do I get teenagers out of their room, give them the autonomy and independence they need that they just can't have now?
Yeah, that's been sort of a recurrent issue that parents have been bringing to our attention. And what I often tell parents is that your teenager may not be wanting to necessarily come and interact with you because they find it more interesting to interact with their peers. The parents are not the most exciting people to hang out with, and for that matter, it could be even their siblings. So when you do have that window with them, try and make it like a very positive interaction. Keep away from contentious issues. Show interest in what they are doing. Be curious about their life and create that kind of easygoing communication. When you do that, you are making them realize that you respect them. And that should hopefully want them to spend more time with their parents and not just their peers. Teenagers are known to have that kind of behavior just because of all the changes that are happening within their body and their brain. They are looking to be independent and they are just struggling through that. We as adults can make that easier for them and maintain good communication with them. When it comes to the screen time, we have to remember that when they don't want to be with us because we might be having some negative interactions with them, we might be disciplining them, we might be nagging them about things. So at least for now in the pandemic, let's not go to those areas. Let's talk about something more positive so that we can get them to spend time more with us and less on their iPads and phones. And if they still want some extra time, like I mentioned very much in the beginning, please do allow it, because for them, for their own well-being, it's important that they socialize with peers.
Thank you so much, Dr. Merchant. Next question is a second question from Louise Legere, Medical Post. And I'll ask Dr. Merchant to answer this one. While you've covered what parents should look for in terms of mental health in kids, is there anything you would ask family physicians to do or to look for when they are seeing children and teens to help with this overall growth in mental health issues?
So again, I'm going back to what I said initially, that if you are seeing any concerns with your teenager, please call your family doctor. They are the best first point of contact. And they are also aware of the child's health, previous mental health, previous cognitive issues, school-related issues, or learning disability. So they have that background. And then they can sort of put into context the current symptoms. And if they feel that this is something that needs to be addressed by a pediatrician or a psychiatrist, then that allows them that opportunity. Your family doctor is your step up as a screener. So I usually say the first screener is the parent, the second screener is the teacher, and the third screener is your family doctor. But the teachers are sometimes there and sometimes not because of the school closures. But that should be your first contact, because they might be able to piece together that information and then direct the referral to either a pediatrician if it's developmental in nature, or even mental health, or if it is something that they're even more concerned about, then to psychiatry. In some cases, if it's an emergency, like a crisis situation with suicide, and which has happened quite a bit during the last year, then they would be able to direct the parent as to bring the child to the crisis centers that we have set up around the country in emergency rooms. So I think that it is important, because a lot can happen, and you can be directed and triaged and sent to the right place by just contacting your family doctor.
Thank you, Dr. Merchant. The next question I'll ask Dr. Hill to answer, but our panelists might also have additional comments. It's from Sneh Dugel at Queen's Park Briefing. It's been mentioned that families should seek help if they start seeing signs of depression, anxiety, etc. in their children. But what more can be done to address the concerns raised today about the impact of the pandemic on children? Is there a role for the province to play? And what more could the government do?
So my understanding of the question is, what do we want the government to do to better protect our children, in addition to what we're all already trying to do ourselves? I think it's a great question. I think it's one that speaks to all of us feeling like we don't have enough resources right now. We don't have enough bandwidth, and worrying about our children. Honestly, the most important thing the government can do right now is help us all get the pandemic under control, so that life can go back to normal, so that we can go back to having our kids in schools, so that we can go back to having our kids at parks, interacting with each other freely, so that we can go back to having parents who want to and need to be at work focused on one thing at a time instead of 3 or 4 things at a time. Apart from that, as far as extra resources that might need to be put into the healthcare system afterwards, I think it's too early to know where we're going with that, but I suspect some of my panelists, my co-panelists, might have some ideas as well.
I would like to make a special mention of publicly funded mental health resources. Whenever I'm seeing children with anxiety and depression or eating disorders, and I need them to see a therapist, as we know in the province of Ontario, those services are not covered by OHIP. I have a lot of families who are not able to afford those services. So if there is, going forward, as we already alluded to this fact that this might be a long-term thing, this might continue even after we have controlled the pandemic, then we are looking at a need for a huge amount of publicly funded mental health resources. So if there's one thing that I would like, because that is where I find that my my parents are really struggling, and especially given the current time with the financial stress.
And I would add one last thing, just from an injury prevention perspective. We know that infrastructure is actually the best way to prevent injuries in children and adults. So, for example, with the cycling increase we've seen in the last year, building protected bike lanes and intersections that are, where kids can be seen, et cetera, is actually very important. And that would certainly fall to the government as well to make sure that we have the best built environment for children, especially when we go back to school and kids are going to be walking back to school again. We're going to have to make sure that we have all those kind of ducks in a row to make sure we don't see any unintentional injuries or collisions from that.
Thank you, Dr. Rosenfield, Merchant, and Hill. The next question is actually a follow-up for Dr. Merchant from Louise Legere. So what advice would you have for family physicians noticing signs and symptoms around anxiety and depression?
So over the last year, I have been working with a multitude of family physicians in my area, and they have been actually quite good in terms of screening their children and making appropriate referrals. At their end, there are a lot of screening questionnaires that they can use. I find that with teenagers, the good thing is that they're very savvy technologically. So there are a lot of questionnaires that are electronic, and there are websites whereby you as a physician can sign up, and then they can sign up and go to the questionnaire, and then it's emailed back to you. So, even if you're not able to see the child in the office, if you can do a virtual appointment with the child and get them to do that questionnaire. There's a multitude of questionnaires, and I don't want to get into that because it gets very technical. But there's multiple questionnaires available specifically for children, even children in different age groups, that can be done virtually, and that can be sent into the family doctor to review, and then accordingly make the necessary referrals. I'm going to make the same pitch for developmental delays and social delays. Children in the age group of 2 and 3, or I would say even beginning at 18 months, should be screened for autism. And we are already a year into the pandemic, and we need to make sure that they are being screened at the primary care level so that they can be referred on for assessments. And the pandemic should not delay that, because the Ontario Autism Program is still providing funding for those children who can get a diagnosis. So you're screening not only for anxiety and depression, but we're screening for a lot of other conditions like autism spectrum disorder, for which funding is currently available, but they require a diagnosis before that funding can be accessed. Children who are in school are having difficulties with focus, and so ADHD, and then difficulties with learning and learning disorders. All these can be still assessed during the pandemic because of the ability to do a lot of these things virtually.
Great, thank you, Dr. Merchant. We have our last question, and it's for Dr. Farah. Sorry, I've lost it, my apologies. When we have vaccination for kids, should we use it as an opportunity to get them caught up on missed childhood vaccinations?
Actually, that's a great question. I would recommend that all children leading up to when the COVID vaccine is available, make sure that their other vaccines are up to date. Right now, the recommendation for anybody receiving a COVID vaccine is that you have not received a vaccine in the last month. I don't know what this will look like for children in terms of whether the recommendation will be the same, but it is really important that every child is up to date with their vaccines moving forward before the COVID vaccine is even made available. Once it is available, we really need to make sure that all kids are vaccinated.
Thank you, Dr. Farah. So that concludes our Q&A for today. Thank you to our reporters for their questions, and thank you so much to our panelists. I'm going to pass it over to Dr. Hill to make concluding remarks.
Thank you again, everyone. Thank you, Ryan, for some excellent moderating, and thank you to my co-panelists. Thank you to all of those who attended today's briefing and your thoughtful questions. I will flag a couple of concerns that we didn't discuss here today that are worth considering as we move forward. One, in relation to a question that was asked on the chat around violence, domestic violence, and potential child abuse. And so we know that during the first shutdown, there was significant concern around the idea that children would be missing, or incidences of abuse would be missing. And so it's really important that we not lose sight of that as we go forward. The other thing that I wanted to flag was simply that we have seen COVID-19 have very discrepant effects across various demographics of various geographical regions. Racialized communities have done much more poorly. Poorer communities, lower socioeconomic class communities have done much more poorly. It behooves us all to make sure that our next generation, our children, are spared those kind of inequities as much as possible, and that we resolve them. And that is all part of the same discussion about what we want out of the world and out of healthcare after COVID-19 pandemic. So with those notes, I hope the session was helpful in informing your reporting. I look forward to watching and reading your coverage. And if there's a different topic that you'd like to hear us discuss, please send along your suggestions to media@oma.org. Thank you again for all of your time. Stay safe and stay healthy.